Hi everyone. As we prepare for the upcoming holiday season, one that will be much different than those we've had in the past, it is important that we take a step back and evaluate what's currently happening throughout much of the world from a broader perspective. While we are certainly right to be concerned with the health of our immediate friends and family, neighbors, and loved ones, focusing solely on this side of the equation is a terrible mistake, which could have profound effects on not just our future, but for future generations. The emergence of COVID-19 and the subsequent lockdowns has been dominating our collective consciousness this year. This is due mainly to overwhelming media and government propaganda, which is focused on case numbers and deaths, and the need for increased lockdowns and social distancing, two terms which largely, in this context, didn't even exist before this year. But what has been largely ignored has been the tremendous social and economic costs of such policies. Like any decision or policy, the lockdowns come with trade-offs, and it is these costs that I would like to explore in this short video, which highlights the callous disregard for the other side of the equation. When properly factored into the coronavirus equation, we can plainly see the unprecedented, catastrophic physical, emotional, economic, and psychological effects of the lockdowns, which, if you look at the comparative data, have little or no effect on the spread or mortality of the virus. As we go through these statistics, please ask yourselves why these concerns have been so readily brushed aside, and why we are being told that these lives don't matter. All of the following comes from mainstream sources, which I will provide in the description. Let's begin with some mental health data. Suicidal thoughts is massively on the rise in the US. About 11% of adults had suicide this year compared to just 4.3% in 2018. In an average year, people between the ages of 18 and 25 who contemplate suicide at least once is between 6.8 and 11% over a 12-month period. Now, the CDC finds that percentage for the 18 to 25 group has shot up to 25.5%, and not just in the previous 12 months, but over a 30-day period. Also from the CDC, reported symptoms of anxiety were 3 times higher than they were in the second quarter of 2019, and reported symptoms of depression were 4 times higher. Between April and October of this year, the portion of emergency visits related to mental health for children ages 5 to 11 increased by 24%, and 31% for 12 to 17-year-olds compared to 2019. According to the CDC, during late June 2020, 40% of all U.S. adults reported to be struggling with mental health or substance abuse. According to the AMA, more than 40 states have reported increases in opioid-related mortality this year. From January to March of this year, over 19,000 people died from drug overdoses, which is 3,000 more than 2019, the same quarter. According to the British medical journal The Lancet, quote, during lockdown, people with dementia or severe mental illness had a higher risk of excess death. Dementia patients had a 53% greater chance of death, and elderly patients with severe mental illness had a 123% greater chance of death. A recent study sought to determine how many deaths of despair, that is from drug or alcohol abuse or suicide, that will occur as a result of the lockdowns. Their estimate, according to CBS News, about 75,000 more compared to an average year. Now let's look at the results of the lockdowns from a broader health perspective. As a direct result of the lockdowns, the New York Times reports that there will be 1.4 million excess tuberculosis deaths, 500,000 more HIV deaths, and 385,000 more malaria deaths. UNICEF recently warned that 1.2 million child deaths are coming due to the global lockdowns. The UN has warned that as many as 130 million people are at risk of starvation because of the very real possibility of famine in several dozen places around the world, which were brought on by lockdown-induced disruptions of supply chains. The CDC estimates that 94,000 non-COVID excess deaths this year, including 42,000 from cardiovascular conditions, 10,000 from diabetes, and 4,000 from cancer. And many of these were caused by the cancellation of non-essential care in the midst of the panic. A United Nations report in April warned that economic hardship generated by the radical interruptions of commerce could result in hundreds of thousands of additional child deaths in 2020. The report further warned that 42 to 66 million children could fall into extreme poverty as a result of the crisis. These poorest of the poor live a hand-to-mouth existence, which means they have to work all day just to be able to feed their families that night. Quote, when you ask them to stay home, in many cases you're asking them to starve. Another quote, the absurd demand that developing countries adopt economically disastrous lockdowns is driving untold misery. Over in the UK, cancer authorities have been warning that the lockdowns will wind up leading to as many or more avoidable deaths than COVID deaths there. As many as 60,000 more. The UK's Sunday Express reported that increased cancer fatalities will result from the redeployment of health resources caused by the hysteria. The BBC says the same. In fact, Richard Sullivan, a professor of cancer and global health at King's College London and the director of its Institute of Cancer Policy, quote, the number of deaths due to the disruption of cancer services is likely to outweigh the number of deaths from the coronavirus itself. The cessation and delay of cancer care will cause considerable avoidable suffering. Cancer screening services have stopped, which means we will miss our chance to catch many cancers when they are treatable and curable, such as cervical, bowel, and breast. When we do restart normal service after delivery, after the lockdown is lifted, the backlog of cases will be a huge challenge to the healthcare system. According to the Daily Mail in October, vital operations were canceled and patients missed out on potentially life-saving therapy in the spring because tackling COVID-19 became the sole focus of the health service instead of cancer and other diseases. Almost 2.5 million people missed out on cancer screening, referrals, or treatment at the height of the lockdown, even though the UK NHS was never overwhelmed, despite fears it would be crippled by the pandemic. It should go without saying that most, if not all of you, have been impacted economically in some way due to the lockdowns. Millions have lost their jobs and small business has been decimated. Since May, over 8 million Americans, or 2.5% of the population, has fallen into poverty. Looking specifically at the restaurant industry, for example, it is set to lose $240 billion in revenue this year and 8 million employees. 86% of restaurants reduced staff due to COVID-19, and 40% of restaurants are expected to close by March of next year. Finally, how many millions of elderly have died this year without being able to see their loved ones? To me, this has got to be the most evil and immoral aspect of the whole response. "Oh, I'm sorry, Grandma. You're just going to have to die alone." "No, Judy, you absolutely cannot say goodbye to your mother." And the worst part is that the majority of people are just fine going along with it. What happened to our heart, our morality, our ethics, our sense of dignity? It is truly heartbreaking and horrific to witness. While we are solely fixated on this one particular virus, we are largely ignoring the death and destruction of countless millions of lives. The collateral damage of the government's response to COVID-19 has led to a global catastrophe unparalleled in our lifetimes. I don't want to live in this kind of world, and neither should you. We need to speak up now with love, compassion, and even righteous anger, and let it be known that this is unacceptable in a free, moral society. This has been presented in the direction of truth and love. Thanks for listening.